Hi, I'm Jim Atkins. I practice in San Antonio, and about 10 days ago, I had an opportunity to use the new Rhinaer 2.0 device, which is Aerin Medical's upgrade to their Rhinaer 1.0 device. And I'd like to go over today what upgrades they've made and what my experience was using it for the first couple of times. First, financial disclosures. I have no financial interest in Aerin Medical. I'm not a shareholder. I'm not a consultant. I wasn't paid to make this video. I actually paid for the device myself. It wasn't given to me. I did ask Aerin Medical some technical questions about the device, but other than that, this was all on me. First thing to say is that the generator and the hand grip are unchanged, so you're not going to find any changes on those two portions of the device. There are 4 changes that were made to the device. 2 of them are related to the shaft and 2 are related to the treatment tip. This is a picture of the Rhinaer 1.0 device on the left and the 2.0 device on the right. And I'm going to go through the changes here. The first change is that the old shaft was stiff and rather large in diameter. The new one, the proximal shaft, is non-malleable, just like the original version, but it is 19% narrower than the original shaft. There's now a distal portion of the shaft, which is malleable and 43% narrower than the original shaft. So that's quite an improvement, and I'll go over the malleability quite a bit in a little bit. The second 2 changes to the tip have to do with the fact that the old tip was flat, as you can see from this little red line, and the new tip has a 10-degree offset. The reason for that is that if you put a 10-degree bend in the shaft, and this isn't bent because I'm graphically challenged, but I just tilted the device to show you what I'm talking about. If you put a 10-degree bend in the shaft, the tip is going to flatten out so you can oppose it against the tissue in an even flat manner. With regards to other changes, the new tip is 20% shorter, which is nice. Doesn't take up as much room in the back of the nose, but the electrodes are unchanged, so you don't have to really worry about whether you're getting the same treatment area you are. You just don't have as big a device that you have to apply it with. This is a video of me using it on the left side of the first patient I treated. There's a little blood back there. That's not from the Rhinaer device. That's from some cottonoids I had back in the sphenoethmoid recess. And I'm just going to let you watch this for a second, but you'll see what I do. And I think most people do the same way. Is they take their original treatment area and then apply several treatments, working their way anteriorly and inferiorly. And I get the last couple of ones on the superior posterior portion of the inferior turbinate. The first thing that I want to comment on is that the thinner and malleable shaft and the smaller tip greatly improve visibility and access. I had no problem treating this patient. Now, there weren't any challenging anatomy problems like a septal deviation or a high riding turbinate or concha bullosa or anything like that. But nevertheless, it was very easy to treat the patient. And with some of the previous devices that I've used, it was kind of hard to see the treatment area because the device was obstructing your view. But the smaller tip and being able to angle the head away from you so you can kind of see around the shaft really made things a lot easier to see. Comment about your technique. This isn't a Vivere or even the first Rhinaer, because the first Rhinaer and the Vivere are very stiff, and you can actually use them to apply significant pressure to the tissue, whether you're trying to outfracture an inferior turbinate or make some indentation in the treatment area of a swell body or reshape the cartilage if you're doing a nasal valve. But this device is malleable at the end. And so what I figured out here is that you need to apply it to the sidewall. So apposition, not force, is what we're looking for. Because I didn't show you the right side because I didn't do it this way on the right side. I was cranking on it like it was one of the previous Rhinaer devices and putting a lot of lateral pressure, and I bent the malleable portion considerably on the first treatment side. But then I wised up and realized what I needed to do to make it work, like you just saw in the video. So if you have any concerns about whether you're contacting the area you're treating, you don't really have to apply additional pressure to relieve those concerns. You just have to rely on the machine because the electrodes measure impedance. And if you're not up against the tissue, it's not going to run. So if it runs when you hit the foot pedal and starts clicking off seconds, it's working for you. Now, if you push the foot pedal and it gives you an impedance error, you need to readjust the tip and make sure you have good apposition. So in summary, I'm very impressed. The device is much easier to use. Visibility is a lot greater. I think it's a considerable upgrade to their previous product, and they obviously put a lot of thought into it. I've used it twice now. As I said, I used it 10 days ago and I used it again 2 days ago. Was very impressed both times. So in closing, leave any questions and or comments in the comments section. And this is a new channel that Ray Weiss and Biloxi, Mississippi and myself are going to be moderating. And it's going to be easier to get other physicians to upload content to this channel if we have subscribers. And subscribers aren't going to want to come if we don't have any content. So you can help us out since you're already here by subscribing and help get the ball rolling. Greatly appreciate it. Have a good day.